Because of the cold weather, it makes it more difficult to socially distance, and more people are going indoors. We also have the beginning of flu season upon us, and many people's double vaccinations are beginning to wane. Immunity is waning, so if you take the cold weather, you take waning immunity, you take flu season, that's the perfect storm for people getting sick with COVID. Our positivity rate was nearly 5% yesterday, and the governor and I are concerned because we had a day earlier this week where we were at 8%, and we know that unvaccinated people have a 4.5 times greater risk of testing positive for COVID compared to fully vaccinated people. And the risk of dying is 31 times greater for those that are unvaccinated. We continue to have a pandemic of unvaccinated people. Right now, 79% of the more than 500 people that are in the hospital with COVID are people who are not fully vaccinated. So we are very happy to be here in East Hartford at Stone Academy for a pop-up clinic to help with vaccinations here in East Hartford. As of December 1st, 72.9% of the residents here have had at least one dose of the vaccine, and 65.7% are fully vaccinated. So you can see that we still have some work to do. And as the Christmas holidays and New Year's is approaching, we want to spend time with friends and family, but we need to do that in a safe way. And so that's why we are trying to highlight pop-up vaccine sites like this one. My husband is getting his booster this afternoon at 3 o'clock in preparation for our holiday celebrations at our house. And we want to get the message out to the people of Connecticut how important this is. What I love about this site is there are $20 gift cards that are being given out as an incentive to get vaccinated. Oh, can we see what that looks like? Look at this. Okay, and where's this for?
Dollar General.
Dollar General $20 gift cards if you show up to this vaccination site. I love that creative idea. Anybody ages 12 and up can get a shot here today. You do not need a photo ID, and you do not need insurance, and you do not need an appointment. And it's started up over here at 10 o'clock, and it looks like there's some capacity for more people, so we hope people come down or find a pop-up location when it's convenient. And many of our pharmacies across the state have appointments available, CVS, Walgreens. So please, 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 let's take the opportunity, just take a few minutes to get your booster, to get your vaccination. Keep wearing masks when you're indoors. These things will go a long way to keeping yourself and your family safe. And it's better for all of us because the more of us that get vaccinated, the fewer people who are left to be hosts for the Omicron variant and any other variant that might pop up, because that's only one of many that could still be out there. So I really appreciate Stone Academy and our partnership with not only our amazing state public health department, but also our local public health authorities. And you're going to be hearing from the East Hartford Public Health Director in a moment. But it is now my pleasure to introduce one of the fierce advocates for East Hartford, and that is Senator Anwar, who in his other life, when he's not a legislator, he is actually treating people with COVID-19 because he is a pulmonologist. Did I get that right? Excellent. All right, with that, Senator Anwar.
Thank you. Good morning, everyone. I'm Senator Saud Anwar, S-A-U-D, Anwar, A-N-W-A-R. I was also asked to spell my name. I had to actually look it up. In my other life, I'm an intensivist and a pulmonologist, and I've been working for the past 3 days, and I got off the hospital at 7 a.m. this morning. I am going to share with you my concerns and what is the ground reality in our communities. The last many patients that I have seen in the intensive care unit have all been COVID patients. More than half of our patients in the hospital, in the intensive care unit, are COVID patients. And almost all of them are unvaccinated except a couple who actually were not boosted. So their last dose was more than 6 months ago. So this is real. This is it's bringing about the memories, and as I was talking to the nursing staff, everyone, this is reminding us of March of 2020. And we cannot afford to be back there. All of us have had a low-grade PTSD from what we experienced. And this is preventable, this is critical, and I am seeing the painful situation where when somebody is on 100% oxygen and they are struggling for every breath, it's too late to get vaccinated then. The time to get vaccinated and boosted is now, before you get infected. And the virus, the only host for the virus that we are worried about is humans. And humans are the only ones who can protect themselves. And we have the technology. If you look at what's happening in the rest of the world, people are literally dying to be able to get the vaccine. And we have it available and we are not taking it. It's like painful to see that. And then you see the challenges of the family members who are saying that we have been talking to their loved one to get vaccinated. The families are getting divided. The information that is out there, by the time you find out it's wrong, it's too late. So listen to the people who have invested their entire lives in public health, people who have invested all of their experience, work, including our Commissioner of Public Health, who has done more than anyone that I know in these communities, in the state. We need to make sure that we listen to the experts, and please, please protect yourself and your loved ones, and make sure you do this, because when they're in the intensive care unit, we have limited options. Thank you, Lieutenant Governor, for your leadership, your work. I'm truly a fan of yours for your work that you do. Thank you. Thank you.
Thank you so much, Senator and Dr. Anwar. It's now my pleasure to bring up our Public Health Commissioner, Jitani.
Thank you very much for that. I'm not sure if I'm supposed to also spell and pronounce my name. I'm Dr. Manisha Jutani, M-A-N-I-S-H-A, J-U-T-H-A-N-I. You know, when I hear Senator and Dr. Anwar talk about his experiences overnight, it brings back a lot of memories for me too. And it is very difficult to think about all the people who needlessly are continuing to suffer from this disease and die. Healthcare workers are really at the end of their rope. People are tired, and it is extremely painful now to watch people die when we know we have a preventable disease. So thank you for your work. I don't do this every day anymore now, but I feel your pain. I remember it. My goal now is to try to advocate from the level of my role as Commissioner of the Department of Public Health. And I know that there's a lot of misinformation out there. There's people and families that have been divided over the information that is out there. I can tell you, as a public health advocate, as a physician, that this disease is preventable. It really is. And some people have said, well, I know people who got COVID even though they got vaccinated. Well, if you have a mild case and you don't end up in the hospital, that is a win for this vaccine. And that's a win for you and your family who wants to still have you around the dinner table this holiday season. Boosting is a simple thing we can do as well. I know for a lot of people, they weren't sure if they needed a booster Then they weren't sure if they were going to get a booster, felt like, they're probably fine, they got vaccinated. The guidance is now clear. If you are 18 and older, you should get a booster. And I also know that there are a lot of struggles people feel sometimes, that they've tried to get out there and get a vaccine appointment, and maybe they've had difficulty. This is why DPH is going to be around the state in locations just like this one with pop-up clinics. And I want to thank our DPH staff that has been doing this work tirelessly and showing up everywhere that they can. And we are ready to be in new locations if we need to be able to have pop-up clinics available so people can just walk in and get your booster shot and get your first shot if you haven't yet. There's no shame in that. There's nothing wrong with deciding late. For some people, it's just been they needed time. They wanted to think about it. They wanted to see others around them. The evidence is clear. Please come in and get your shot. For the young people, I just want to say that for many of you, we know that for our 65 and older population, we're over 50% in terms of getting boosted, and we continue to march our way up, and I want to see that number continue to go up. Our younger population are the ones that maybe have been on the sidelines for a little longer. They felt like maybe they don't need a booster. And now people are seeing the consequences of that. And as we go into the holiday season, even if you have a milder case, but you can boost your immunity and prevent getting COVID altogether, that's still worth it. Because you don't want to have to be set away for 10 days where maybe you miss a holiday with your family, even if you have a mild case. So why not just get a booster? Come to a clinic like this and just get that shot. And because I know that maybe availability may be a little harder, this is an option, and we're going to do our best to make it as easy as possible for people to get out there and get that booster. So with that, I want to thank everybody for their efforts on this, and I am going to turn it back over to the Lieutenant Governor.
Thank you. Commissioner, thank you so much. And one of the reasons that we are here in East Hartford is East Hartford is a very diverse place, and the governor and I are going around the state prior to the holidays to make sure that our socially vulnerable communities have access to vaccinations and to boosters because we know that communities of color have suffered in disparate ways. More people of color have gotten sick and have died, and that's why one of the many reasons that we are here in East Hartford, and we're very privileged to have East Hartford's Public Health Director, and I hope you'll say a few words.
Good morning and welcome to East Hartford. My name is Lawrence Burnstead, L-A-U, R-E-N-C-E, B as in boy, U-R-N-S-E-D. And I want to thank everybody for being here for this pop-up clinic. We really appreciate as a town of East Hartford for the partnerships that we've had with our state and private and community-based organizations to help us fill the need for conducting vaccination clinics. We've been a partner with Griffin Hospital with conducting clinics in addition to the ones that our own town staff have been utilizing since the beginning, since the program started back around April of earlier this year. We saw that capacity need for providing additional services for our residents as well as for our towns around us, those that were looking for the best available and closest clinic as it is. And just want to also add on to a little bit in regards to the need that we're seeing. When it comes to our community transmission rates, we were actually doing pretty well as far as moderate transmission just a few weeks ago, but with some of the latest numbers that are coming out, we're back to high transmission once again for East Hartford. We're seeing a substantial increase in cases on a daily basis. We're seeing an increase into our positive lab rates, and that's just not good. It's very important for people to recognize that if you have not received your booster and you're eligible for those that are 18 years of age and older, we encourage you to get your booster shot. And also the reason why we're still here doing pop-up clinics is for the importance of still providing access for individuals that may not have received that first dose of vaccine. That is the reason why we continue to provide accessibility with organizations such as Stone Academy and working with Griffin Hospital is to make sure that we bring clinics as close as possible to individuals that may have access challenges like transportation issues. or time of day. So we're doing clinics not only just during regular business days like this, we've been out here on weekends, evenings, throughout the town, advertising and assuring that individuals know that they have a choice when they're ready and they have their questions answered when it comes to hesitancy. And it's really helped. Just want to stress that when we looked at our numbers back in April, when some of the early numbers were just coming out, we were in the bottom 10 percentile when it came to vaccination coverage. But now, with the latest numbers, we're kind of close to hitting the state average. We've seen ourselves increase substantially to where fully vaccinated for individuals, we're at 65%, 73% with at least one dose. But we are still seeing a disparity here. One is with older adults, 45 years of age and older, we are doing just as well as the rest of the state. More than 88% have received at least one dose. However, for our younger adults, 18 to 24-year-olds, for example, only 64% have received at least one vaccine. We need to make ground when it comes to our younger adults, and we are still also seeing gaps in coverage when it comes to individuals that may be our minority populations. And there is an importance for us to get as many people as possible vaccinated so we can really make a dent in the curve and try to impact and protect not only yourself, but your family members and your loved ones by getting vaccinated. So whether it's your first dose, your missed booster, or you're finally needing that or missed second dose, or now you need your booster, we encourage you to find a clinic that's near you, such as the one here at Stone Academy, so that way you can get your booster as soon as possible, or go ahead and get on schedule to finally get vaccinated. And just want to also, quick add-in point, the gift cards that were referenced, they are targeted for first dose recipients. We unfortunately with grant funds are not able to provide gift cards to every individual. We see a very high demand for boosters, so we apologize for that. It's specific for first dose recipients. We're trying to incentivize providing that additional gift card to help individuals, especially if it might help them when it comes to around the holidays with additional funds, or with supplementing if they needed to pay for transportation, for example, to get here, so we can try to return that so they can still feel comfortable coming here for a clinic. So again, we've made a great strides here in East Hartford, just like many communities, but there's still work to do, which is why we will continue to be providing clinics. We ask individuals to check the State Department of Public Health's website or 211 for available clinics, or you can contact the Town of East Hartford's Health Department number at 291-7324, and we can assist you with identifying the nearest clinic if you're an East Hartford resident to assist you with your access. So with that, want to go ahead and introduce Mr. Todd Liu, with Vice President General Counsel with Griffin Hospital Health.
Well, thank you. I think I'm batting cleanup today. I guess I'll follow the protocol and give my first name, last name, Todd Liu, T-O-D-D. Last name is spelled L-I-U. I've got the shortest name here today to spell. I just want to reinforce a few points that were made earlier by some of the other speakers who spoke really passionately and very strongly for the need for people to get vaccinated and to get their booster shots. Statewide, we are seeing more and more capacity constraints in Connecticut hospitals. Right now, a little short of 80% of all hospital staff beds are occupied. There are fewer and fewer beds that are open for patients that have COVID, which is why it's really important that we want to prevent people from getting COVID in the first place and coming to the hospital. Once they get to the hospital, for those especially that are unvaccinated, we have fewer and fewer things that we can do to help save their lives if they're really, really sick. There are some therapies that we can provide to them. But if they're unvaccinated, they're far more likely to get really, really bad disease. And their likelihood of getting out of the hospital is far less than if they are vaccinated coming in. So want to drive that point home. Really, really important for people that have been waiting. They haven't been sure. This is the time to come get vaccinated, even if it's getting your first shot. Getting your first shot, even if it's the first shot of a 2-dose series, is going to help to protect you from this virus. So please make that decision. I also want to just give some quick thanks to folks that are really critical to making this program work for us. We've done over 4,380 mobile vaccination clinics across the state. We focus our efforts in towns and cities that have a high social vulnerability index. So we're trying to make sure that we're closing the gap for particularly for brown and for black populations that have been hit hardest by this disease, and also have some of the greatest access challenges. But this program can't work in a vacuum. It's only successful when it's a partnership between local health, between the leaders at our state health department and also sites like Stone Academy that really help ensure that everything runs smoothly and that we provide the access to people that are coming to get vaccinated. So thank you to our partners. We depend on you, and without your leadership, we couldn't make this happen. That's all I have. I want to thank everyone again for their tremendous support. Thank the Lieutenant Governor. Thank our local health director, who's also been a tremendous partner for us. And again, thank the folks at Stone Academy for having us here today.
Great. Thank you so much, Todd. And we have all of these experts over here, so if the media has any questions.
I have a quick question for the Commissioner. I'm wondering if this latest uptick in hospitalization numbers is connected to the Thanksgiving holiday, and if there's anything in specific that you want to speak to in terms of the hospitalization uptick.
So the hospitalization uptick, of course, is concerning, and I do think it's a combination of things that has happened. We know that viruses circulate, respiratory viruses in general, circulate more easily in low humidity times than in the winter. We know that people are gathering and it's colder now, people are indoors. We have waning immunity, as the Lieutenant Governor mentioned. So it's a combination of things, but certainly the Thanksgiving holiday could be part of that. One of the things as we think about additional gatherings that are happening as we're going forward, so what are the things that we can do to try to prevent some of the spread? We can make sure you're boosted, so optimize your immunity before you're gathering together. You can do an at-home test or a PCR test a few days before if you need to, before you're gathering, if that makes you more comfortable, if you're especially going to be with more vulnerable people. So that is another way, and especially the at-home tests are an easier way to get you, they're not foolproof. They are better than nothing, though. And if you're going to be in larger groups and you're with people who you don't know and you don't know their vaccination status, we know the masks work. And so that is, we know the tools. Everybody knows the tools that we have. And people have to decide how they want to use them and optimize the safety of their loved ones.
And then I have a quick question for Mr. Liu. Yes. Sure. You mentioned the 80% beds occupied. I was just wondering if you were talking about Griffin specifically or Connecticut in general.
I was referring to Connecticut as a whole. So again, about 80% of all staff beds in the state are occupied, not all with COVID patients, but the percent of COVID patients right now in Connecticut hospitals is about 9%. And that percent has been climbing over the past couple months, which is why we're concerned. There are fewer beds and more patients in the hospital with COVID. And as I mentioned before, what we can do for those patients that are really sick with COVID in the hospital is challenging.
I have a question. 3 states now in the Northeast are bringing in the National Guard to help with surging. It's Maine, New York, and now New Hampshire. I was wondering what kind of conversations are happening at Connecticut level. What is the status perhaps for both the Lieutenant Governor and the Commissioner, and perhaps Dr. Liu or Mr. Liu about what the situation is at Connecticut hospitals, not only with the capacity of beds, but the workforce available to handle the surge, and what are the next steps in Connecticut going forward?
First of all, I'll say about the National Guard is they were incredibly critical during the pandemic, especially last spring. They were building mobile hospital units in case we got to the point where we needed more capacity in our hospitals, and they did an amazing job managing the logistics of getting ventilators and PPE out. So the governor and I are in regular contact with General Yvonne. We have regular calls with all of our cabinet members to make sure we know if we need to start taking steps to activate the National Guard. We are not there yet. I know that the governor and I are very concerned about the 500 people in the hospital, and we're monitoring this every day. We don't want to go to a situation where we have to say, okay, we're stopping elective procedures, which we did during the pandemic because we wanted to have that extra capacity. So, we're not ready to activate the Guard, but we are fortunate that we have hundreds of men and women that are at the ready if we need them. And Commissioner, if you want to add anything, please. Please do.
I will just say that, I agree with everything the Lieutenant Governor said. I also think that one of our challenges is skilled workers and, the skill level of the worker and how many of those types of people are even in the National Guard. So those are the things we continue to evaluate, and that's why we need to continue to partner with our hospitals and assess the situation as it continues to evolve.
Is there a combination between, not only with the surge, but also, I think the senator mentioned it too, there has been burnout over the last 18 months. People have retired or left the healthcare workforce, but people are still interested in getting in it. So how is that playing out now where I'm sure health systems have positions to fill right now and they're also battling a surge?
Maybe Todd can talk about
Sure.
that, Commissioner.
Happy to take that one.
Sorry.
That's okay. I believe it was the senator who mentioned that, this has been a really, really long haul. And nurses, physicians, and other caregivers at the bedside, they are very tired from this. We at Griffin have some of the same challenges that other hospitals across the state are experiencing. Nationally, about 25% of all emergency room nurses have left the field. So that by itself has created tremendous...
Wait, can you say that again?
Sure. Nationally, 25% of all nurses, ER nurses, have left the field.
Goodness.
And that's through a combination of things, right? Retirements, people deciding that they want to change professions or maybe do something different than ER nursing. That alone has created tremendous challenges for us and for others. The other thing that is a real challenge now is COVID is everywhere across the entire country. So at the start of the pandemic, in Connecticut, right, the March, April timeframe, Connecticut was one of the early states to get hit, which meant that we were able to pull in travel staff from other states that were not yet experiencing this COVID crunch. Now, because it's everywhere, and because every hospital across the country is fighting this virus, there aren't the same staff to pull in from other areas that we were pulling in from before. So these staffing challenges are real, and people's ability to kind of continue and be resilient through this continues to be more and more challenging as we go forward. That being said, I think I'd be remiss if I didn't give a shout out and a salute to our healthcare workers that really have been heroes throughout this entire thing. But for their dedication and for their resilience, we would not be able to be where we are today.
Can I add a couple of things?
Sure,
Yeah,
please.
please, go ahead.
So I'll just add from the intensive care unit perspective, we've talked about the hospitals having a certain percentage, but if you look at the number of intensive care unit beds, the percentage of those beds occupied by critical patients from COVID is much higher. So that's part of our challenge. And in the intensive care unit, interacting with the nursing staff across the state for that matter, there is real burnout. And you're seeing some of the nursing staff. The reason is that any nurse and physician who actually has vulnerable people in their homes, they have to adapt according to the risk that they will bring to their loved ones. And also having to gown up with all the PPEs and then protecting yourself, it just burns you out. And then also the challenges that many of them have, there is real PTSD when I was just saying that the individuals who were, what we had experienced was quite significant. And now seeing the numbers increase, many of those staff have actually already retired. And now we are seeing individuals, you'd be surprised many of the times when you interact with the staff, they're from another state. And then a lot of travel nurses have been coming to help out in the intensive care unit. But like was mentioned earlier, we will run out of that option too. And I was receiving calls from other hospitals saying, can you give us one bed? And this was because they don't have staff for that bed. They have a physical space, but they don't have a bed. And these were, some of the calls were of non-COVID patients. So, and that is what is at stake. If somebody is going to have a heart attack and they have no place to go because the entire hospital is filled with COVID patients, that person is not going to make it. And so if people make a choice that is going to impact them directly, they have every right. But when they make a choice that's going to impact everybody else, then you have to have a collective responsibility for that. And I think that's what we are pleading in all different ways that we are saying is that, please listen. Your choice is harming and literally going to kill other people. and then you can avoid it and you can prevent it, and you can do it today in East Hartford, and come in, no questions asked, and you're going to be addressed, and then we'll take care of you. That's what it's about, and the data is so sound now. We have so much more data now that we can actually do this. So if anybody wants to have a conversation one-to-one, we are available to do that too. But it's very important. Thank you.
All right. Dr. Anwar, I just want to say thank you for speaking out on this topic, because you live this every day when you were doing your work at the hospital, taking care of very ill COVID patients. So we appreciate the fine point you have put on this. So with that, any other questions from the media? All right. Thanks so much, everybody. Appreciate it.